The Bub Hub Club is proudly brought to you by Kayana Photography, Fully Sick Bags, and The Pregnant Book.
Hi, and welcome back to the Bub Hub Club. I'm Brad Lauder, your host and co-founder of the Bub Hub, Australia's most popular parenting portal. The Bub Hub offers a wealth of information and advice on countless parenting topics, from conception, pregnancy, birth, babies, and beyond. In this episode, we'll be chatting about early feeding, a topic that can cause a lot of stress for parents in those early weeks. So stay tuned. Welcome back. Probably something I should not know as much as I do about is breastfeeding. It's a little sus for me to be giving information about breastfeeding to mothers, but I have been doing the website for 10 years, so I feel I have a little bit of knowledge here, probably much more than I need. But those first few days with a new baby can be very difficult. And for many parents, feeding a new baby can cause a great deal of stress. It certainly helps if you go in already knowing the answers to some of the big questions, like how often does a new baby feed? How do you know if you're getting enough? And am I doing this properly? In this episode, we're going to be talking to the experts and answering some of these questions. We are joined by J1 and J2, Jen Mitro and Jenny Watts. Thanks for coming, ladies. Jen Mitro is the Assistant President of the Queensland branch of the Australian Breastfeeding Association. She's an ABA counsellor and a certified lactation consultant. Jen became involved with the ABA after her first child was born. She now has 2 children and another on the way. Jenny Watts is a midwife, lactation specialist and child health nurse who has lived and breathed babies, infants and toddlers and their families for the majority of her working life. She works in a busy tertiary referral hospital, conducts infant clinics in the community and runs a private lactation consultancy. Plus she has 3 children of her own. We'll start with you, Jen. We are big supporters of breastfeeding on the Bub Hub because of the important benefits to both mother and child. We want mums to have all the information they need to give them the best chance of breastfeeding successfully. Can you tell our viewers what some of these benefits are?
Well, there's many benefits for the mum and the baby. Firstly, for the baby, it gives them everything they need for the first 6 months of life. It provides optimal brain, speech and eye development for them. It's the perfect food, so it changes to suit the needs of the baby. And it also helps to fulfil that special need for the bond between the mum and the baby.
Yes, that is great. And Jenny, is it because of these known benefits that we're hearing about a growing number of mums who are exclusively bottle feeding express breast milk? Or is it just because the expressing systems are so much better?
There's a whole lot of factors with the whole expressing system with mothers and babies. For some women, it's their choice. They've tried the breastfeeding and they, particularly for whatever reason, they've decided to give their babies a breast milk via a bottle. For others, there could be other issues. Each mother we need to take individually, yes. And the baby, prem babies, and because they all know how wonderful breast milk is.
Yes, again, we've stated this on, over and over again during the series, that every journey is different, and just because something worked for your first child doesn't mean it will work for your second child. So it's really, really important to relax and look for more information. Jen, do you have any hints on learning to breastfeed, and is there anything parents can do before the baby is born?
Well, your breasts naturally change during pregnancy to get ready for breastfeeding, so there's nothing physical that you really need to do. It's a really great idea for mums to do a bit of preparation, and dads as well, do a bit of background reading and learn about how your breasts work and how they make milk, and then you're more prepared for doing the breastfeeding when the time comes, because it is a learnt skill for mums, although it's instinct for the babies.
Yes. Jenny, what about if a baby is born prematurely? How does that impact early feeding?
Okay, premature babies, depending on the age and the gestation of the baby, may not be able to initially breastfeed. So there can be some 35-weekers that will come out and suck and be able to feed. There are other babies who till 37, 38 weeks cannot coordinate the suck-swallow reflex. Right. Really paramount for those babies is that we work a plan with them, that they're given, like the mother starts pumping very, very early. They're supported with that. They're supported with the use of the pumps, the use of the expression of the breast milk, and the mode of that baby is given that milk too.
Excellent. Now, this is a key question. How will a new mum know when and how often she should feed her baby, Jen?
That's a very good question. At the Breastfeeding Association, we recommend that you feed baby according to their need. So babies instinctively want to know when, will tell you when to feed, and they'll often do this through early cues, such as sucking on their hands, wriggling around, having a bit of a look for the breast. And that's a really great point for mum to pop baby on the breast and see how it goes. If you wait too late then and baby starts crying, you've missed those early cues, and then it can be more tricky to get baby properly attached.
Okay. Jenny, we talked briefly about mums who exclusively feed express breast milk, but what about the mum who'd like to express for one-off occasion? Is it a good idea to wait till the baby is a certain age?
It also, again, depends on the gestation of the baby. Like, each baby needs to be taken of its own agenda. A premature baby, it may not be optimal at any stage in the early time to introduce a bottle for that baby. A baby with a suck dysfunction, a baby who is confused with breastfeeding. If a baby, some babies you can will feed very quickly and easily be adapted across any sort of teeth. There are other babies that will be a bit more resistant. So early we say for a term baby, 6 weeks we like them to wait or till they've really fully established breastfeeding.
Okay, all right, that's good. Jen, many expectant mothers are worried that they will experience difficulties breastfeeding. What tips can you give on attaching your baby, and why is it so important?
It's really important to get attachment right from the beginning, so you can avoid any other issues that may pop up. So I've got a baby here. We need to firstly get mummy really comfortable too, because that's the main thing. And then we need to support baby well. So we're putting our hand on the shoulder blades. We're never touching baby on the head because we don't want to push it onto the breast. We also want to have baby's head nice and extended, and also bring the tongue out over the bottom lip. Making sure baby's nice and calm and comfortable is a really good way to start. We want to make sure that the chin is dug into the breast, and then the nose is nice and clear, which gives it a nice angle to let the nose go to the back of the mouth.
Okay, that's great. What are the key things a mum should do to attach her baby to the breast and look out for?
So as I said, the angles are really important, looking at your own nipples and breasts as well. So not everyone will want to be feeding in the same way. Another thing to do is to do some baby-led attachment, where you recline a little bit and put baby on your chest, and that's often what they do when baby first comes out at the hospital, because babies have that natural instinct to find the breast by themselves, and they're very good at that.
Okay. So why does it hurt some mothers to breastfeed?
Poor latching. Some babies can come out, it depends on their birth. Mm-hmm. So working in a tertiary hospital with thousands of babies born every year, it is important for the mothers to understand if it does hurt, it shouldn't, yep. And they need to get professional support.
Yeah, always a good idea. There's always lots of places to go for help. The ABA, midwives, lactation consultants, they're everywhere. Make sure they're accredited if you can, but again, always ask for help. And that leads me into where mums can go to get help. Excellent. I've leapt over that myself. So besides the ABA and midwives, what other ways can mums get help on breastfeeding?
The Australian Breastfeeding Association is fantastic, and they have a book which is really didactic and supports everything that all new mums that want to breastfeed. It's a lovely sort of forum for them. The ABA groups where mothers can actually just talk and have professional presentators that actually go through different age-appropriate behaviour. Mm-hmm. But in the early phases, it's really important that they understand what their babies are doing, they feel comfortable, they feel supported. New mums groups, health professionals, lactation consultants, drop-in baby centres at the hospitals.
Yeah. Look, it's a natural process, and really all we're trying to do is make sure the mums have the information they need to have the best chance of breastfeeding, and, whether they can or not, that's, there's always issues for some people, but give yourself the best chance. We'll be back after the break to talk about breastfeeding issues beyond those early weeks, and we'll also look at the topic of bottle feeding. Stay tuned. Welcome back. We're joined by early feeding experts Jen Mitro and Jenny Watts. So far we've talked about the early days of breastfeeding and a newborn, but now we're going to look beyond those first few weeks. We'll also look at the topic of bottle feeding. Many new mothers experience engorgement and mastitis, which are two separate issues. Is this the time to wean, and how do you relieve engorgement, ladies?
In the early days, when your milk first comes in, mums do tend to get quite heavy breasts, and they're filled with blood, milk and other fluids. This is the time to feed baby as much as you can and tell your breasts how much milk to make for the baby.
And that's the engorgement. So mastitis, Jenny?
Mastitis is another whole different, like, we don't want women to get mastitis.
Absolutely not.
Golden rule is the breast should never ever be full, sore or uncomfortable. What's really important for the mothers is for them, if they are worried, if they feel their breasts are too full or there is issues, they need to get a medical person or a lactation consultant or a midwife to review those breasts or out in the community so that it doesn't move into the next phase, which can cause a lot more problems.
Okay. Jenny, what can they do if they're finding breastfeeding frustrating, which we know happens a lot?
The ABA line is fantastic for them to identify. If I see them in my clinics or in the community, to identify what is it, to actually find out what was their expectations and to work through those sometimes just to normalise their feelings of being a new mum.
Yes.
So new mother groups and the ABA support them beautifully and help to alleviate some of that. I professionally do it a little bit more didactic and individually.
Yeah, exactly. Again, ask for help is the key point there. Is there a difference in the volume a baby takes between breast milk and formula?
Yeah, there is quite a huge amount of difference with babies.
This is why I asked the question. More information, please.
Okay. Breast milk is so uniquely developed for the baby. So each baby, the mother, the baby, the unit, the breast milk is absolutely sorted. So some babies will take 100 mils of feed if you were measuring that. Other times they could take 200 mils of feed, some older babies.
Yep.
There are some babies that never take beyond 150 mils if the mothers have taken those babies off the breast and are doing because they're away and separated.
Yep.
With formula, some mothers, depends on those early phases. With demand bottle feeding, we're seeing less of it. In the olden days, we used to if you looked at the side of the tins of formula, there was huge overrated volumes that the mothers were perceived to be trying to give those babies as much as they could, which we've now moved away from that. We're really looking at the individual babies and their needs, demand bottle feeding, demand breastfeeding, and the demand breastfeeding of breast milk.
And again, with breast milk, there's less for the babies to get rid of through the bottom end because they're absorbing it all because it's really good for them, whereas formula can lead to things like constipation because there's stuff in the formula that the baby doesn't need, so they get rid of it.
It's a whole separate title of its own, and it really, when families are looking into bottle feed or into artificially feeding or introducing any artificial feeds in their children's diets, they need to really research their bases, research what they're giving the children, research the type, and discuss it with a health professional.
Okay, you mentioned demand bottle feeding. What's that?
Demand bottle feeding is a concept that is getting a lot more momentum now. It's where we look at how different we are in shape and sizes and genetics. And there are some babies who will happily...
Everyone looks like me. No?
Some babies, some families, genetically, you've got the 6'5" tall father, the 6 foot tall mother. That baby genetically is going to probably demand more food, as opposed to a 5 foot tall lady, a very small little husband. That baby may genetically be just not need those huge requirements. Would never take 200 mils of feed.
Oh, that's right. Because my 3 foot tall parents, I obviously fed a bit more than is needed. Jen, how many parents many parents want to know how you manage returning to work when you're breastfeeding?
Yeah, well, a lot of mums go back to work and successfully breastfeed at the same time nowadays. It may be a matter of negotiating with your own employer, your own things, but ABA has a great thing called the Breastfeeding Friendly Workplace Program, which helps support the employers and the employees to work out something and also give them some information as well. Well,
let's face it, breastfeeding mothers and mothers in general have a lot to offer the workplace, so employers that are helping them out are certainly going to benefit from having the opportunity to employ some very qualified people. Jenny, do you have some tips for those introducing a bottle to an older baby, whether it be express breast milk or formula?
Well, it has to be the sort of teat. I mean, it depends older. Some 5-month-old babies refuse. A breastfed baby, many breastfed babies never have a teat and will not like to do it. So cups, different sort of feeding cup systems work better for those infants.
Yes.
And sometimes there's enormous amounts of teats on the market. The peristaltic orthodontic ones, more stimulate the breastfed baby, can be a little bit more successful, but again, it's trial.
Well, there's so many different bottles and bottle teats out there now, so it's always ready options for you to have a look at. If a baby bottle feeds, can they still breastfeed?
Depends on, I mean, they can. It depends on when you're talking about. If a baby requires the mother separated or going to work and wanting to give that baby breast milk, pump breast milk, then if that's what works for her and that baby, they can, as long as she gives the baby good access to the breast when she returns through periods. Babies are quite adaptable.
Yeah, again, it's important that the baby's had the breastfeeding and then moves into bottle feeding.
As opposed to,
and instead of the other way around. Now, what if your baby won't take a bottle? Do you have different advice depending on age, ladies?
Baby's so different, so it's really hard to say what works for one won't necessarily work for the other. Mums spend a lot of money and time looking at different options, but a lot of babies can just take a cup once they get to a certain age, so that rules out any need for those type of things at all.
Yeah, it's a little messy around the high chair, but they'll get over that as they go. As your baby grows, how do they know when they are ready to drop feeds, Jen?
Well, as I said before, it's better to feed baby according to their need. We're looking at the signs of whether they're getting enough, so wet nappies and things like that. But otherwise, if baby doesn't seem hungry for a feed, there's no need to offer it. Some mums, when they're choosing to wean, won't offer but won't refuse again as well.
Yeah. Well, and it's important as well, and particularly in somewhere like God's country, Queensland, where it's hotter in summer, that you may need to feed a little more, because particularly if baby's only taking breast milk, they'll need more liquids during really hot days. So that's really important. What are the ongoing benefits of breastfeeding as your baby grows older, ladies?
Well, breast milk adapts really easily to this age of the baby, which is fantastic. So as the baby gets older, they'll start making, for example, long chain fatty acids such as omega-3, and they'll still provide a lot of nutrition for the baby even when they're taking solids. Also, that immunity to diseases and infections is a really important part of it as well.
There's some really good benefits for mums though as well, aren't there?
Yeah. Mothers, I mean, the bonding issue is, of course, one of the big paramounts, but other issues?
Weight loss is really handy.
Yes, I wish I'd weaned earlier.
But also with mums, it can reduce their chances of getting breast cancer, ovarian cancer, heart disease, diabetes and osteoporosis. So it's very important.
So basically, you should try and breastfeed if you can. It's good for everybody. Look, thanks guys. After the break, we'll be asking our experts questions from real mums and dads. There were hundreds to pick from for this topic, so don't go away. Welcome back. We're talking with early feeding experts Jenny Watts and Jen Mitro. Now we have some questions from real mums and dads, BubHub members who have posted their early feeding questions on our forum. We're crossing to Kat, part of the BubHub team, who has picked a few of these questions to put to our experts.
Hi ladies, we've got a couple of questions from our parents on the forum. Our first question is for you, Jen. Should I be dropping feeds now my baby is 10 months? He is eating 3 solid meals plus snacks each day. I'm generally feeding around 5 to 6 times a day, usually just one night feed, sometimes none. He's also starting to refuse his feed before bed. Should I be worried? I feel like I need to keep up the feeds because he's so little, just over 8 kilos.
Well, breastfeeding should be the main source of nutrition up to the age of 1, so it's important to keep going with the breastfeeds. But it is natural for babies to want to cut down their feeds as they take more solids. So it's perfectly reasonable to take fewer breastfeeds, but once again, it's good just to follow your baby's lead and work with that.
Great, thank you. Jenny, we have a question for you about pumping. For those of us who really want to breastfeed but have bubs in special care nurseries, how many times a day should you pump? Which pumps are the best? And how do you transition from tube bottle feeds to breastfeeding?
It's got a broad subject, like the pumping time that a baby, we say, is 120 minutes in a 24-hour period. So 120 minutes of pumping time to really stimulate those breasts depends how old the baby, the gestation of those babies, whether they're really prem, and some women elect to do more than that. The next part of the question asked about
what pumps are the best?
There's a number of pumps on the market, but the one that's probably the most researched at this stage, that we get good volumes of milk across the board with a lot of mothers, tends to be the Medela brand. Medela has, if you Google, they have quite a large database of their research into milk ejection responses.
And how do you transition from bottle feeds to breastfeeding?
Well, it depends on the baby. We try and do tubes, and if the baby was still in hospital, we would be doing tubes and using an orthodontic or peristaltic or Medela Harmony teat. It depends on the baby and how they're coping with that, the teat, and then it would determine working with that baby and that mother to actually get that milk transfer going.
Jen, our next mum wants to know, is breastfeeding easier the second time around, or is there still a period of adjustment?
Well, it must be easier the second time around, but that's not always the case. It's a new baby, you've never breastfed that baby before, and that baby's never breastfed from you. So there will be a period of adjustment always, but you have more experience and you'll also have a lot more background knowledge to help you out as well.
Confidence.
Jenny, Our next question is about sterilising. I'm confused about sterilising. What are the current recommendations for sterilising? Is it necessary or not?
Well, we now actually, even in hospitals, say that we actually just warm soapy water and air dry. Same as if you're at home, unless you're using formula, you can use the steam sterilisers. But there is a high incidence of thrush with a lot of babies, and so we encourage wiping those sterilisers out with vinegar once a day if the baby has got thrush. But for breast milk and breast milk exclusive and your breast milk pumps, just warm soapy water and air dry. You can store it in the fridge in an airtight container.
Thank you. Jen, we have a question from a mother of twins. I have twins and I'm looking for advice on how to find the time to increase my supply. How can I fit into my already busy day of breastfeeding twins, plus pumping and settling bubs, while still having time to sleep, drink and toilet?
Well, this mum's doing very well to breastfeed twins. It is normal, it is natural for a mum to be able to breastfeed 2 or more children, but she's got to sort of maybe look at the reasons why she needs to increase her supply. We usually say to feed baby according to need, so if she's feeding babies and allowing them to have access to the breast, hopefully that she's producing enough milk with that. And if she needs to pump more, she may like to ring the helpline and have a chat about how she can fit that into her day. But most of all, she needs to pat herself on the back for doing such a great job.
Jenny, is it necessary to advance to step 2 formula, the 6-month plus one, if it constipates bub?
No. The formulas are way dominant formulas of the type. Some babies can remain on those for 12 months. I mean, we've only moved... So really, again, you need to talk to your health professional and be advised on what's suiting that baby. Particularly 12 months, they can stay on the normal formulas, as I said, to 12 months.
Jen, can you tell me what is meant by cluster feeding?
Well, cluster feeding is really normal for a newborn. Often they'd like to take several little feeds over a period of 1 or 2 hours, and often this is followed by a nice long sleep as well. So because we talked about earlier, babies' tummies are so little and breast milk so easily absorbed, it's not really unusual for a baby to want to feed quite regularly like that.
This question is about premature babies and is for Jenny. I'm confused about how much formula my baby needs. If I go by the packet, do I use their birth age or their correct age, as mine was premature? Also, if bubs are wanting extra feeds, do you have extra bottles of same volume or start taking out of the calculated daily allocation?
Okay, when we're dealing with anything with babies, we need to be really specific about the age of the baby, their weight and how nutritionally what they require. So no, you actually, for babies, you really need to be a specialised, to go to a health clinic sister or your medico doctor to actually look at what those babies' requirements are. There are some babies that will take more demand, like we spoke about in a previous episode about demand feeding. It's the same with the babies at breast or bottle fed. Demand feeding is where we're now meeting the needs of those babies. They have growth spurts, so require more, and it may be the same volume, it may be a little bit less, as long as they're not going into the feeding every hour and creating issues.
Thank you. And we have our final question for Jen. What do you do when your older child has weaned but then suddenly starts showing interest in breastfeeding again when they see other babies being breastfed?
Well, it's great that they show an interest in breastfeeding, but it's very normal for babies, for older children to be interested in everything that the newborn's doing, especially feeding, because it takes up so much of mum's time. Mum might choose to offer the breast to that baby again, but most often if the baby hasn't fed for a while, they've probably lost the instinct to be able to feed anyway. So mum might like to offer some special cuddles or some other special activities to do with that child to make them feel that they're not missing out on anything.
Thank you so much for your answers, ladies.
Thank you.
Well, that's all for this episode. And again, I'd like to thank our guests, Jenny and Jen. We are very keen for parents to be aware that every journey is different and that there are lots of different ways to approach breastfeeding. Talk to friends, experts, or refer to forums. To join the ABA or for more information on breastfeeding, including things like returning to paid work and breastfeeding out and about, visit ABA's website, which is www.breastfeeding.asn.au, or call the Breastfeeding Helpline, which is 1800-MUM, the number 2 MUM, or 1800-686-268. Jenny is a lactation consultant around town, and again, we're just keen for everyone to do the best they can to try, but if you have any questions, look for help. Remember, if you have any questions about feeding your baby, you can ask them on the forum, along with countless other parenting topics. The Bub Hub is Australia's leading independent parenting website, and with more than 100,000 forum members, this topic is extremely popular, so you're sure to find whatever it is you're looking for on the site. Tune in next week when we discuss the all-important topic of sleep. You won't want to miss that one. Remember that every journey is different and that you are not alone.
Bub Hub Club is proudly brought to you by Kayana Photography, Fully Sick Bags and The Pregnant Book.